Hey, this is Dr. Jerry Beinhauer with Aptly. We're here at the DPC Summit 2025 in New Orleans, and we have Clint Flanagan here. Hey, Clint.
Hey, how you doing, Jerry?
Good, it's great to have you. So I'm so excited to be here with you at the conference. I was wondering if you can tell us a story about maybe kind of an interaction you've had with a patient that really made a difference in their life and that really impacted you as well.
We've got a lot of stories, but one that stands out here a while ago was a engineer that we take care of. Married, family of 2 young kids, and he came in to see us. He thought it was pretty healthy. I think this was maybe his first or second visit, and we drew some labs on him, and his cholesterol came back really high. Like specifically, one of his markers, his LDL, was like 210 or so, and his apolipoprotein B was like 140, he was maybe 46 or so. No diabetes, no obesity, non-smoker, and otherwise feeling pretty well. And so we said, hey, let's go ahead and get a heart scan on him. So we got this coronary calcium scan on him, and that number was in the 800s. And we very quickly care coordinated for him to see one of our excellent cardiology groups in the Denver metro area. So they saw him, and he did not do well on his stress test. And that immediately took him to the cath lab, where unfortunately his vessels were in a place where they couldn't stent the vessels, and immediately from there went to surgery and had a 3-vessel bypass
At 46.
At 46. Wow. So these are the one-offs, right? And this was a gent though that thought he was otherwise pretty healthy, and his company paid for Nextera Healthcare, so he came in to see us, on-site clinic. And you kind of just think about that guy, as many of us know on the medical field, that right there would have probably impacted his life much earlier than he wanted it to, right? Like he'd have been lucky maybe to see age 50, and here he connected with us, got his bypass, and was doing fine. So that's one example of just having a relationship with a direct primary care doctor that, not only is going to improve his overall morbidity and mortality, but you can imagine as a husband and a dad, right, that, those kids, their dad's going to be around a little bit longer.
That's awesome. Did he have a primary care doctor before that or no?
Great question. So previously an employer had offered a United PPO plan, and he's an engineer, and the wait time to get in was months, and it just was, even though his employer was offering that plan, he, to our knowledge, just hadn't established or hadn't been down that pathway yet. This is a middle-aged 40-some-year-old gent that should have had a primary care doctor, right? That was a PhD engineer that had resources to get that, and yet in Denver, Colorado, he hadn't seen a clinician, and or had they found that.
Wow. Yeah. Well, awesome story, Clint. I mean, this is the kind of thing that you hear about. It's just really why people love to go into DPC physician-wise, and why the patients, I think, are taking so much better care.
Yeah, 100%. This is our 16th year at Nextera, and that is one of thousands of stories of where we're making an impact. And it's a lot of fun, and arguably best way to do medicine in the country.
Thanks. Well, Clint, thank you so much. It's good to see you today. I appreciate it.